for doing those things. Assalamu alaikum. Good day, everyone. I hope you all are doing well, and happy Ramadan also. And also, uh, Autism Awareness Week is upon us. Like, people are celebrating our Autism Awareness Acceptance Week. And today, we also have soon, on 2nd April, we will have a Autism Awareness Day. Like, it is celebrated worldwide. And I would like to thank Dr. Ahmed, because we just look up on I really appreciate the effort that he do, and I keep on telling the effort he is doing, like door to door, more to people, and giving them mental health services, and that is a very amazing model, I would say that. And meanwhile, we started to uh, talk about autism, and he asked me to do that, to let him understand and let the team understand about autism, because I am working with some youth from Gambia related region, and they don't even have a psychiatrist over there. They only have 2 or 3 people who is capturing the whole population. So thank you so much, Dr. Ahmed. Would you like to introduce a participant, and then we will start?
Thank you, Dr. Anila Khan. It's a great honor, and it's a great pleasure to meet with you. So the participants, all the participants are our colleague. Both of them, they are health workers, and some other colleagues who indirectly work for mental health or health. So most of them, they were from mental hospital, Bur'a Mental Hospital, Mandaye. And some of us, I can't see their names, apart from Fahima, and also Dr. Faul, Dr. Faul, and also Dr. Abdurrahman Yassin, and others will join us laterly as I expecting. So you welcome all the guests or all the participants. This Dr. Anila Khan, she leads Islamabad in Pakistan. She's a mental health expert. So she will give us a training for mental health, particularly child mental health, particularly ADHD and also autism.
Yeah, first autism.
That
yeah, you go through.
Exactly. We will take that 2 disorders, and as you might aware, that 2 disorders, autism and or mental health, child mental health disorders, we need to know more about them, because of it's very rare or very difficult to find out a solution for that disorders. When people meet with us, we give counseling about only counseling, but we still need some training about mental health, particularly autism and ADHD. So Dr. Anila will train us autism first and then ADHD. So Dr. Anila, we are very happy to see with you again. We have met before. So you welcome, Dr. Anila.
So thank you so much.
You're very welcome.
Yes. Thank you so much. I would say I would really appreciate the effort that you people are doing. And I'm talking to so many people like worldwide, and my effort was just to make people understand that what is different. Like, if you look toward, you might have seen children who have disability that is visible disabilities. Like, if somebody have low vision, you can understand that the child is having low vision. If somebody have low hearing, he's having some kind of hearing impairment, aid, like that we call hearing aid. The child is using hearing aid, or somebody would use some wheelchair. But if you look toward those children, they look like normal to you, but they have hidden disabilities, or they have hidden struggle, I would say. They have hidden things that are not apparent to other people. So as a society, they will think that they are not listening to parents. They are not obedient children. They don't want to listen to parents. They don't, they are, they don't have manner, so that they have to sit in front of people, and they are, just running around, and they are, invading the property and doing those things, and they don't understand that what the child is going through. And we really need to understand the aspect that why the child is doing that. And the other thing is that uh, those situations can be manageable. And we know that there are a lot of children who might cannot speak, and aggression is also coming because of that way. Because if the child is not able to communicate with you properly, then it end up in getting the child being more aggressive. Because situation sometimes, if you talk about school, sometimes situations happen where a child have no fault, but if you look toward naughty children, they will put that thing on that child, and the child is going to get punished for that. And we have seen so many, even when in circumstances where this happened with the children. So for that understanding, we need to understand that what are those conditions. And when we will understand that, then we will later on look toward the uh, solution for those things too. So so now let's start. I'm going to start my and thank you so much, Fahima, if I'm not pronouncing your name wrong. Uh, I know that you're a green activist, and I'm really happy that.
Thank you, Dr. Amira. I'm listening. I'm listening.
Okay, let's start. Yes, let's start screen share. See, can you see the screen?
Yeah, we can see it.
Okay, let's do that.
Yes, we can. Yes, we can see.
So it is basically, you're like, today we are going to talk about autism. Usually you will see that it is autism spectrum disorder, but sometimes now people start calling it autism spectrum condition, and it is because of so many reasons. Because if you look toward the criteria and the language that is written, sometimes it is very hurtful language. Like impairment in this thing, impairment in that thing. A child is no, not following certain thing. So uh, sometimes we need to understand that even if those people have problems, we need to understand the factor that we need to use a language that is not harmful for them, and they don't feel guilty about their conditions. So that is the people start talking about languages. So now let's see what is basically autism spectrum condition, autism spectrum disorder. It is basically kind of a developmental condition that is a persistent challenge with uh, social communication, and people have restrictive interests and repetitive behaviors. While autism is considered a lifelong condition, we need to understand that thing also, that if somebody has some problem in childhood, that thing is going to continue with that child. And that is same thing, like for example, if a child have or we or have any kind of physical condition, that doesn't go away. You cannot cure those conditions, but you can manage those conditions. Same like we can manage the condition which we have as in our physical thing, in our physical problem. So it is kind of some impairment, you could say, or some degree of challenges in communication. The individual so much. I just lost the track of my presentation. I think I need to go back and start again. So we are talking about criteria. And the other thing is that there are some functioning would be changed, like they're not able to socialize with people. And the first thing, if somebody would come to you and the parent would say the child is not responding to our name, that is the first indicator. People start talking about that. And those sometimes this also happens that those children who have autism or who are autistic, they will develop language and then they will regress in language. So that is also come in between that. And some we also need to understand over here that uh, a child could have language problem in other disorders too. So if they don't have language, you need to consider the other factors too. And the other thing is that if the child is not listening or not responding, the child need to check his hearing also. So hearing test and eye test could be something you could do for ruling out that condition, that why the child is not looking toward you, why the child is not responding to your name, why the child is not able to pick something. So we need to understand that and the other point is that We will talk later on about, the social communication problem, restrictive interest, but that is more like uh, the child cannot go and play with other children because of certain reasons. The child have their own reason, and there's something also that the child do some restrictive behaviors. From restrictive behavior, I mean that some routine, the child will follow a routine, and if things go beyond that, like if the child you're not able to give those things to the child is going to get upset for that. And there are certain reasons why it's happening, but let's talk about social communication interaction skill. um, the thing that we are talking about over here, you can ask that from the child too. And let me tell you something, because a lot of you people are doctor too. Now we have a very new developmental checklist. So you need to keep that thing in your mind also, because when we were studying the developmental checklist, the developmental milestone list for the children, at that time we were not able to understand, because there were certain things which were not according to the child, who have autism, who are autistic, or girls and boys in that perspective. But now we have a very new list that is published in in last year, at the end of the year. You can consult that too, because they added autistic traits in that too. So the criteria is according to that. So also consult that when you are trying to understand what is the condition, and what we need to keep in mind when somebody is coming to you. So if a child, and from communication, what we mean, communication is not just about language, talking to each other. There are many things too. There are behavior perspective in that too. So let's see that if a child come to you, a parent come to you, and they are saying that the child is not doing certain things, and the child have behavior problems, stuff like that. And one thing is that sometimes parents would come to you very late also, like the child is 4 or 5 years of age, it will come to you. But if you start taking the history of the child, what will you ask? The child would avoid eye contact when he was young, like the point is that it is very overwhelming, that's why they cannot do it. And there's another reason for that also. The child would avoid contact, or people or adult who are artists, they would avoid contact, because it is overwhelming, and sometimes it is difficult for them to use two senses together, like eyes, hearing, listening and hearing. They cannot do certain, because it could be uh, confusing for them. So they use one senses, and that's why they cannot use both of them senses. But it doesn't mean that these senses are not working. They have their own reason for doing that. Now the other thing is that they would not respond to him at the age of 9 months. And from it means that when a child is 9 months and people start calling the name, and we have seen that even if the child is not responding to name, maybe if there's some sound around, he would listen to that or not. So that could be indicator that the child hearing is working or not, but the child will not respond to name. And the other thing is that the child will not show any kind of emotion or expression, like happiness, sadness, anger or surprise at the age of 9 months. But sometimes the child could show also. So the point is they are learning through imitation. Imitation is means copying something. So they can learn those things too. And the other thing is that they do not play simple interactive games like peekaboo at the age of 12 months. It is basically a general criteria that those are some play games, that those are some interactive games that the child will not play. The child will stay quiet. The child will start to want to play with their own things. And what we call those children, we call those children that these are very calm child. A child need to make noises. It is very important the child need to make noise. It is very important when the child is born. The first cry is very important, because if the child will not cry the moment after he is born, it means that the child is not able to oxygen is not going to his brain. And if oxygen will not go, then we have the condition that is called cerebral palsy, or there could other troubles with that child too. And if the child is not, you need to understand that the child is getting oxygen or not, and then you need to put that child in the incubator. So that is something side a thing. But I'm just saying that like the child is not playing interactive games and use few or no gesture by 12 month or age. And it's like the child is not interactive. Even the child could be interactive too. It's not necessary that the child is following that criteria. That's why it get confusing. That's a lot of people that we see in our classroom, maybe study room. Later on we get this idea that those individuals are autistic, and they can have interactive games too. So these are general things to understand, and you can ask those questions, and you can ask those questions while taking the history from the parent. That will help you to understand that. Now The other thing is that now you understand that from communication and language, we mean two-way communication. Uh, Language is not about talking only. Language is not about you able to talk or not, you able to say something or not. It is about how you can interact with other person, how you can respond to that cues, and and do you understand that, for example, if we say that no, no, the meaning of no is very different in different circumstances. So we have different kind of a communication when we are home, and we have different kind of communication when we are outside. Same, our behavior is different too, but those children could have problems in that. That's why it gets challenging for them. And now the other thing is that share interest with other by 15 months of age, for example, show you an object that like that they like. It's more like that they want to play with their own things, because the thing that they're around, they could find some kind of attachment with that thing. It does not point to show you something interesting, maybe at some age. Like, it's more about they're not able to tell. And you also need to understand that when we talk about communication, or it's of two types, communication of two types, receptive communication and, sorry, language. Receptive language and expressive language. Receptive language mean that uh, the child is able to receive things or not, in terms of, if I say that this is a mobile phone, do the child know that this is a mobile phone? And if we say that this is a cup, the child know that this is a cup or not? Because if a child is wandering around here and there, the child is not paying attention to when you are talking. So first, when we start working with that children, we have to understand that we need to start developing um, uh, shared interest with each other. Like, that is a therapeutic side of that. But the point is that first understand that why the child is not responding to you. The child is able to talk, that's a separate thing, but the child is responding to you or not, that is a thing. And if a child is not able to do that, then you need to see that you need to start working on that. You need to start working on the vocabulary of the child. And it could be very simple thing too, for example, body parts, other things, but that is coming in the therapeutic side. But over here, I'm just trying to say that the child will not say that. Okay, for example, if you're a doctor and child come to you and ask his name, he will not maybe able to respond. Ask the body parts, what body parts you have, like where's eye. These are some simple things that the child will respond to you. And that will also help you out to develop a bond with the child. And there's one other challenge too. Those children will not able to get comfortable when they will first time reach to you. So you cannot um, maybe diagnose that child when the child come to you. You're not able to understand that the child have certain kind of a thing, because he's not comfortable. He's anxious around, because the environment is new for him. The school environment, maybe the hospital environment is new for you, new for that child. And that will be a reason why the child is behaving in certain way, why the child is anxious, why the child want to run, but why the child is not sitting in the place. So these are some important considerations you need to have when you're working with those children. There's also a thing also that when the child is hurt or upset, he's not able to tell you that he's upset. Why? Because maybe he don't know the body parts. Maybe he know the body parts, but he cannot tell you that these are their body parts. So we need to start interacting with that child. That's how you can start communication with that. Other thing is that you will also understand that, see that the child is playing alone in their room. They're not able to play with other children. If it's a girl, there are a few things that's are very much encouraged if we come to girls. Even if you look toward the culture side of that too, like if a girl is very much dependent to the parents, dependent to the family, this is encouraged in our culture. From culture mean, I am talking about the religious perspective over there too. Even if people from other religion or people from other communities, it is prevalent over there too, that it is encouraged that a child, if a girl child is not talking to other people, but they don't understand that it might be indicated of autism too. And there are so many struggles around that. If a girl is not talking, she cannot tell, or child cannot tell you that the child is hurting. Like, if a child is not able to communicate with you, a child is not telling you, we can develop that communication. It's not that we cannot develop that, but the point is the child is and your mother could say that to you, that the child is not telling what is happening in the school, or the child is very shy, or not going other people. If we go outside, the child want to remain with the parents. So these are some indicators, if indicator of that thing. And also that the child cannot play print at something else, like um, the point is, anything you're able to tell to the child, um, uh, or you ask them child to pretend something, to do something, to take participate in something, the child might not able to do that. And also like there's some example where that there's not saying dance or act for you by the age of 60 months. So it's more like that the child is not able to follow the commands that you are doing. And commands also depend on, it could be one step command, it could be two steps command, it could be complex command. Or in the simple word, if you will ask the child to give you the cup, the child might not able to do that, or the child might not understand what you are trying to say because you are saying so many things to the child. So we can simplify the communication too. So that is the easiest way to give you an understanding that the child is able to communicate with you or not, the child is understanding what you're trying to say to him. And that also includes the child might be too much dependent on parents, like going out. And that also include the needs also include that you know challenges the child could have, that it would be in the eating problems. Like you would see that there are few children who have eating problems, like parent would say that they're not able to even take food inside, or they're not eating certain things because they have restrictive diet, or they have problems because they have challenging or differences, they have sensory differences. So taste, smell could affect them, that's why they are not eating that thing. And texture could also affect that. For example, some children like to eat crunchy things, some children like to eat liquid thing. So they might get some trouble with the thing that you're feeding them. So its problem could be in the feeding, problem could be in wearing something, wearing certain texture. For example, you could see that if a child in winters is not able, is just wearing one shirt, the child is not able to wear a lot of things. So that also indicate a sensory struggle the child could have, or we also call it sensory differences. Then problem with toilet training, that is a very important thing to understand, that a lot of students who are not able to do that because they're not able to understand what to do. Or that could be that could be a you could say a thing, separate thing to discuss too, about the toilet training and even the feeding thing. But the point is that these children could have challenges in those things. And these children could also have challenging in wearing dresses, wearing shoes, you know other things, like the passage time I will discuss other thing, but right now I'm talking about the restrictive things. Like you will see the behaviors, because there are certain things that the child would follow, like to follow. For example, they would like to line up toys, other objects, and get upset if somebody is trying to change that. And why they could get upset over there? Because over here it is like a routine. For example, you would see that just try to inquire from the parents that come to you, what child sing, like what child, the parent would say that they are singing all the time, they are using jargons all the time, they are using the lines of the ads all the time, they will sing the poems all the time, but they are not talking to us, or they are not saying anything other than that. Why they do that? Because those things are maybe constant. Like if you talk about three littles, yeah, five little monkeys jumping on the bed, one fell down and bumped his head, and that is kind of a universal thing. That is a poem everybody would sing exactly same way, irrespective of the tone of that music, whatever it is, but it will remain same. The child would love to do that because it is not going to change. If you talk about 1 2 3 4 numbers, it is constant, it is universal everywhere, it's not going to change. But if you talk about ABC, it is there and it is going to remain there, it's not going to change. That's why the children are speaking in that thing. That's why the child is love those things, that's why the child repeating those things. And the moment the child get anxious in certain situation, the child will start repeating that thing, because the child is using this as a stim. That would be child stimming. Because today I'm just giving you a general perspective. Next time we will continue try to do that, because we cannot understand about certain thing in one go. Then we will talk about different perspective over there too. Right now I'm trying to giving you an understanding that if you see those things in your the children that is coming toward you, you need to get alert for that. Okay, let's check for that. Because if you're a doctor, you know that you knew certain test or certain things that you feel certain. For example, if you talk about flu, the child is having this, the child is having body problem, the child is having this, the child is not able to sleep or certain things, then you try to get specification for that. But over here we are just trying to understand that what general things we can inquire from the parent. Now, like I was talking about repeating phrase over and over again, and I tell you the reason why the child is doing that, and that is also called echolalia. And echolalia is how a child is learning to speak also, like learning to speak also. And the play with toys same way every time, because sameness is something going to help them out, because there's a level of executive function involved over here. And executive function is something that we call is uh, helping children and adult to function in the whole day. Now the other thing is that if you talk about even focus of the object, it could be on certain things. They could have certain interests, certain liking, and they would like to follow that. And it could be uh, it could be games, it could be music, it could be art. And also that the point is, if something happened in the environment, even if it's a minor change, they will get that. And that's why they could get upset too. So when a parent come to me and they say that the child is crying, the child is not going to certain room, then we need to understand that what happened in that environment. So the environment around them matter too. So if a parent say to you that a child is crying without any reason, the child is upset, the child starts showing temper tantrums or any kind of a meltdown kind of situation, this could be a reason to that there is some kind of changes in the environment. They cannot accept the change, because if something change in the environment, it's going to hit directly them, and it could be a form of emergency situation for them. They want to resolve that, the brain want to resolve the situation. That's why they're acting like that. Now obsessive interest, like I told you, that obsessive mean they would interest like same, like they would like to. I know a lot of children, I know even not children, just adult also. Some have vast collection of dragons, like 300 or 400 pieces of dragon, like toy. You would see that somebody have a vast collection of cards, vast collection of video games, vast collection of anything. So this is like their interest, and they want to learn about that. Some children could be interested in numbers, some could be children be interested in bit technology. So they have those interests. Must follow certain routines, and routines, like I discuss about the routine, why they follow routine. If they will follow routine, they will understand that what they will need to do, and it will feel them accomplishment too, like eating things same way. And parents also told me that even if it's about the road to, for example, you have a hospital, and hospital have two roads, and if parents want to come from one road with that child to your hospital, if they change that route, the child could get upset from that. So that is a thing that is certain way of following routine. So if the child is getting up every day in the morning, and after waking up he's going to washroom, it is having a routine, it could help child. Or um, if something is missing, the child could get upset over there too, because the brain is not understanding what is happening with me, why this happened, this what and why could um, give kind of a meltdown situation to that child too. Now other is they're having some kind of stimming, some kind of behavior which they do to feel comfortable. For example, if like I'm sitting here for so long, so I am just rocking my body, and I will change the position of my body to just to get comfortable. That's how they are doing certain things too. It could involve hand clapping, body rocking, coming your foot, spinning something, spinning some object. They could play with something, they could have a small toy in their hand, they want to play with that. Or they could have a doll, they could have a video game, they could have a car, even if it's old, they would like to have them again. Now there's another thing is that they have unusual interaction with things and sound and taste and feel. And you will also see that they will do that. And they could use their tongue, or a lot of parents would say that they're eating some kind of non-eatable objects, or they're putting every non-eatable object in their mouth. They're doing because they want to feel things, um, uh, or they want to feel the texture. If they will not do, you will see some children, they would smell things just to have understanding of that, or just to understand what are they dealing with. Now let's talk about other characteristics. Now we talk about delayed language skill already, and language and communication. Sometimes children have speech, but they don't have language skill. Language is also understanding of two communication, like social interaction. Delay movements, it could be also over there. They could have they could have delayed milestone, and milestone is um, speech, cognitive, movement, and like emotional from movement, we mean the child is able to walk on time or not. And if you're working with children, you get this idea that what are developmental milestone. And um, because it is important to understand if a child is able to uh, pass all those milestones, that we don't think that that child have any kind of intellectual disabilities. Otherwise the child could have potential danger of going toward that side. So that's why it's important to understand what a developmental milestone. And we label you could say that we put them label according to that what criteria the child is following according to that developmental milestone. Sometimes if you talk about, even if you talk about autistic individual or children, you will see, you will listen that, and parent could say that the child was talking, but the child get shy, or the child start getting introvert, that the child is not speaking with anyone, and that could happen at the age of 3. 3 is the criteria. You, some people would say that, like, you will see if you read about autism, that after 3, like, that is the onset of a disorder. And there are certain things with that involved also, but the point is that the child could retrograde on those things also. Like, first the child was very above above on everything. For example, a parent would say that the child learned speech very early, the child learned to walk very early, the child learned to talk very early, but the things start getting deteriorating. So it could be because of autism. You need to understand that. Now, delayed cognitive and learning skill, and it doesn't mean that the child have intellectual disability. It's not like that. Intellectual disability is a different thing. Like, I'm just taking the name of talk about that. But autism does not mean intellectual disability. Autism is something else. Intellectual disabilities are something else. Intellectual disabilities have their own side and own things. Autism is a different thing. Um, uh, Another thing is that the child could be hyperactive, impulsive, and or inattentive behavior. Hyper in the sense of running all the time, not sitting in the chair and doing things, and like, it could be also coming in the behavior that the child get hurt so easily. The child is running all the time. The child is getting a lot of bruises on his body because he's so hyper or maybe so impulsive in doing those things. And sometimes those children could have epilepsy or seizures too. Like, they will get fits, and sometimes when they get grow up, these problem goes away in few children. And sometimes people or few children get seizure in sleep too. uh, like, this is prevalent in those children too. And also unusual eating and sleeping habits. And sleep is a problem that a lot of not a lot of, but in many children have, because their pattern is different from other people. Their body is different, their body is sensitive to a lot of things. So it could be like some children are very hyper at the evening time, but they're very dull at the go time. Some are morning children, some are evening children. So sleep problems would be beside it. And eating also would come beside that. Like I told you, some of them have food allergy, some of them don't have food allergy, some of them have a problem with eating, with the texture, spitting something. You would see that they want to eat nuggets all the time. Even some people say that nugget is a universal universal food item for autistic children. And the reason is that uh, uh, the prepared thing that we eat, like the things that are from market, it always remains same, the taste remains same, the manufacturer remains same. The moment it gets changed, I will not eat that again. So just because of sameness, they are going to eat one thing again and again and again. And like I talk about GI issue already, like gastrointestinal issue. And it could be constipation, it could be other problems too, like the child is not able to digest certain food, the child is not getting hungry, the eating are very restrictive, the diet is very restrictive. Unusual moods, you could say, and emotional reactions also, because it could be get complex for that person. Anxiety, stress, and excessive worry, it is coming on. The child remain anxious because when the child get idea that the child is going to new places, new school, new meeting new people, the child could get upset about those things, or it could remain give them anxious, or they could remain it could worry them that what we are going to do, how we are going to talk. And also lack of fear, of more fear than expected. It means that they might lack danger and safety concept. It could happen because of certain reason. And like before this meeting, I was talking to somebody, and she told me that um, she went, like, we are working in different projects with autistic community, like if they're adults or they're children. And she told me that there was a child, and who was the child was there with us, and he was afraid to go and uh, out of the car. The child was not coming out of the car. When she inquired that, and the family told that the child don't the child get you know the child cannot cross the road. When we cross the road, we have to see left and right. Child didn't knew that. But don't you think so? We can tell this child that you can do that. So we can teach the child those things, but for that you need to make efforts. Do not expect that child to learn the way other people are learning. Like, we are putting effort in those children too. The point is we need to put different kind of effort for those children. So just because of fear and danger, anxiety, like of danger. The child was not doing certain things, but now we are working to teach the child how to cross a road, watching left, right, and then cross road, and he can learn that. Eventually, he will learn that actually. Now let's talk about level. um, I'm talking about level 2 because in certain things, when we talk about that, people talk about level of autism like level 1, level 2, level 3. Or if you see the reports that are coming from US and other countryside, you will see that the levels. It means that what kind of support a child requires. So let's talk about level 1. If we talk about that, level 1 social communication characteristic may be, um, it means that the child requires least amount of support. In first thing, it could be trouble understanding or complying with social conversations. Mean, for example, if you go to a party, we have two way of communication. We have two way of, like we talk to each other. The child could lack those things. The child could not understand that. Or it is. Let's talk about adult too, because when a child passes 18 years of age, autism does not go away. It remains with them. The level of the problem could differ, but it remains there. It will be there. So understanding and complying social conversation, like appearances of distinctive social interaction. Like I told you that when I'm working with some of my clients, like they would say that they don't know how to go and how to act in funerals. Like in funeral, there are a lot of people crying, or some of them are talking. So the girl who told me that she don't know what to say to the because it was more like there was a death in the family of that girl, of that girl. She said that I cannot go there because I don't know how to talk to those people, what to say, how to you know how to communicate in that situation, what to say to that girl so that she feels some, how to soothe her actually, because she was crying a lot. So she said that I cannot go again. I'm not, comfortable in going to those places again. Some of emotional and sensitive dysregulation is also there. It means that sometimes there are certain triggers in the environment. Like for example, if you're trying to say something and people are not getting you the way you want to talk to that people, so it could, you could say that it could trigger some kind of reaction. And also, if there are certain things in the environment that could be sensory trigger for that individual, and if it is available over there, if it is over there, uh, the child or the person could get triggered over there. Meltdown is imminent over there. Meltdown could happen in those situations. So uh, everybody or every child or every adult have their own ways uh, to work along that. Or if it's a child, parent could understand that how to calm down the child in that situation. For example, uh, the best example of that situation is those children cannot go, parents say that we cannot go with those children into some functions. We cannot go into shopping malls because the child start crying. If you go to some store, the child will lie on the floor and the child will start crying because the situation in the store, that is over sensory. Like if you talk about autism, it's all about sensory things, sensory overload, sensory differences. It is there, and that is the way, that is the thing that has triggered them the most. There are other things too, but it is very important for them. Now the other thing is that if we talk about interest and repetitive behavior, it can be a need to for additional personal organized strategy. They need to understand that they need to imply something. Behavior rigidity or inflexibility could be there. Stress during transition, and to encounter that, you need to talk to that child early. You need to talk to that adult early. You cannot start doing something, you know you cannot give them surprises. You cannot plan some surprise party for them. Maybe other people, because the word that we usually use for them is neurodivergent, and the other people around them, we call them a neurotypical community. So those who are neurodivergent, if I say neurodivergent, I would mean autism over here. Like neurodivergent, ADHD could be also neurodivergent. They're also neurodivergent, and there are other related conditions too. But if I will use the word neurodivergent over here, then please try to understand that I'm talking about autism. So for neurodivergent community, the transition could be difficult. So you need to tell them in advance. Now they could have attention problems in attention to also focusing on something larger than larger, so longer. For a lot of time, they could not focus in something. So if we talk about ADHD is something. If you see that ADHD have problem with attention span. Sometimes those two conditions overlap. But if you understand from today's discussion, you would get this idea that how autism is different from ADHD. Then the other thing is that when autistic person level 1 social communication might want therapy, like we can help those children out in some one way or other way, and also able them to understand that what strategy could be used for them to emotionally regulate themselves. So emotional regulation is very important for them. Also in school they might benefit from accommodation like extra time, other sensory need, and there are a lot of places where we talk about reasonable adjustment. So we can do that in the school environment too. Now let's talk about level 2 autism. So if we talk about level 2, they might need the level of help which we could give them is greater than level 1. And the traits that could include, if you talk about social communication, is using fewer words or noticeably different speech, missing non-verbal communication cues like facial expression, exhibiting atypical social behavior, not responding or walking away during a conversation. Like you will see that if it is more like if you try to talk to that person, like one of my clients was saying that if somebody want to come to me, they would say that from your expression, it look like you don't want to talk. Like it's on your face. Like the expression is a blank expression on your face. So it's like that. The other thing is that a restrictive interest, it could be any topic, it could be dealing to change and disruption. They could have problem over there too. And also that the people who have level 2, they also need school accommodation in different perspective and support as well. And social interaction, and it's like that you need to plan those things for those children, and those things could work for those children. So if some child is struggling in school, look for that, because like I was talking to in the start, I told you already that it's not necessary that the child is coming to you because he look like he's fine, he is functioning well, but when he go to school he has certain problems. So those problems which we are talking about over here could be labeled as the child is misbehaving, the child is showing defiance, the child is not listening to anyone, the child don't sit on the chair, the child is disruptive, the child is teasing other children. But maybe inside autism is the story, maybe inside ADHD is the story. So by understanding that, we can identify those things. So the other thing is that uh, if we talk about other benefits that could be help them, could be speech therapy, occupational therapy, social skill coaching also. And some people are also saying that AB, but AB is not the only treatment for that. We need to understand that also. There are a lot of people and there are a lot of communities which do not agree to the method that they are using. So it's up to people which kind of treatment they're going for, or which kind of therapy they're going for. So let's talk about level 3, which needs substantial support, and that include it could be non-speaking or echolalia, like they're using the phrase or word and they're doing imitation more. They prefer activity, they want to play alone all the time, and interacting with other only meets immediate need. They're unable to share imaginative play with other peers and demonstrate a limited interest or friendship. Like they're not talking to other people, they have very limited interest and very limited friends. So if we talk about repetitive or restrictive behavior, it could be engage in repetitive physical, rocking, blinking, sitting, hand flapping, moving in circle, have a toy and all the time playing with that. Also express extreme distress when asked to switch the task or focus. Like if you will ask, you might have seen some children, if if you are in your hospital, you would see them, those children are sitting on and they're playing with their mobile phone. If a mother tried to take that mobile phone, you would see that the child starts screaming so loudly that every hospital have to come, or it would look like that something, the child is hurt so badly. And I have seen that mother, sir, in those situations, sometimes police have to come and intervene in those situations. And that was not that mother did something to that child, that was the child needs over there. The child was not able to focus on something, or child was not able to do transition or listen to his mother. So it was like that. So if we talk about level 3 autism, what we can do is we can use alternative communicative devices like HCC, or there's also a thing called picture communication advice, and speech generating software is also there. But some, it could also be the person who could not have any speech or less speech or restrictive speech. Also educational communication accommodation is very important for those children, and specialized program is also available in the school. But over here one thing is very important, that the education plan that we devise for that children, it could be individualized. Like when we talk about assessment of autism, it could be individualized too. Let's talk about treatment, or you could say what are the therapies. Now let's talk about that social skill. And remember that we need to more like device activity for those children, and family involvement is very important over here, that what they can do at home. So if we are doing certain things in our therapeutic rooms, we communicate that with parents that we are doing that thing, and if you will not do that, that it is not going to help parents. So you need to take parents side by side with you, and you need to teach them, or you need to give them some activities to do that activity at home. Because in hospitals, like if you're a doctor, you people also know that we have very limited time, because if you have 30 patients, you have 40 patients in the psychiatry. But if you talk about those children, we need to give them certain time, maybe 20 minutes, maybe 30 minutes, maybe more than that. You cannot do everything over here. Like you just need to, as a therapist, our job is to encourage something, teach child some certain skill, but for repetition of those skills, for repetition of those things, the child need to do that thing at home. So let's talk about social skills. It's done in the group and individual setting, and also interaction with the child, and improve their abilities to navigate social situations. So social skill training is important for them. Then speech and language therapy, like if a child is only one way speech, or the child is only doing, like if it's echolalia or if it's imitation, the child need to understand the patterns, that how, for example, if we say the word no, the no word could be triggered anxiety, or could be a very negative or threatening word for children who have autism. So and the other thing too, that there's a very different meaning of no. If we talk in certain thing, then we need to understand that in every situation our meaning of no is different, our meaning of yes is different, our meaning or way of communicating is different. In speech and language therapy we do that. Now let's talk about occupation therapy. You need to understand there over there too, that they could have problems with their fine motor skill. And from fine motor skill, it could be and there's another sign and symptom over here also, because today I was just going toward a general perspective of autism, that they could have a toe walk, or they would look like clumsy. They could have a pigeon walk, I think it's called pigeon walk. And uh, duck, it's also called duck walk too, I guess it is something like that too. But the point is that they need occupational therapy over there too. So that, because if somebody is all the time doing toe walk, they could have a problem in balance, they could get afraid of going on the stairs. They're so afraid of maybe sometime of the swings too, the swing, the swing that are in the park. So you need to understand that occupational therapy could help over there too. Then there's the other thing too, if your child is not able to pay attention, occupational therapy could help over there too. You can also inculcate those therapy, those activities in the speech therapy. But what you could do, working on attention, it need activity, and it could develop too. Two-way communication, or we call it joint attention, it could be developed over here too. So those therapies are more like over here we are not giving medication, but we are teaching the child a skill, and the skill is through play therapy, maybe art therapy, using colors and music, like that, music therapy. So those therapies are going to help them out. And parent management training is also very important, because let me tell you something. I was working with a child, and he was having because over here sometimes if the child don't have speech, they could have low body too, like, which is called hypotonia. It could be over those children too. So we need to have some kind of activities with that children that could help them out to um, work on their oral motor area, like a mouth, upper palate, lower palate, and this area, which is called larynx, not pharynx, it's called larynx, because there's some vibration or record when we are talking. So if this area is weak, a child is not able to eat. So if we start working with the child oral motor area, then it is going to help them out to eat also. So I was working when I was teaching the child to feed, and mother was saying, I'm not able to do that because the child is taking my so much time over there, and I am feeding by myself. So I just said one thing to that mother, that I was working with this child for 2 or 3 months, like every day. Every day I would give him extra time so that the child start eating by himself. And you are just ruining everything over here. You need to understand that if you will not let the child learn at this moment, the child is going to be dependent on you for whole life. Today he is a child of 5 years of age, like he's 5 years. Tomorrow he will be of 20, 25 years, and he will not be able to eat by himself. You need to be understanding that point over here, that why we are doing certain things, what is the reason we are doing that. And those are the things that we can teach the children. It is possible. We are not talking about something that is not possible. Those management skills are possible, and it is helping children. And we have so many examples in our world and around us. So if somebody gets that diagnosis, that is not the end of life. It is same thing like somebody is having some kind of physical problem. And for physical problem, we go toward prevention. We go toward life child changing skill. So we can say that over here it's same thing like that. So we need to work with parents side by side, and we need to counsel them that what we are doing, why we are doing, what is going to help them out. Next is I don't know things in your area, but there are some special education service over there, and it could like the professional who like when I was talking about assessment, I also used and mentioned the name of individualized education plan. So it is there, and those special education and those special educators sometimes help those students. Those are also called remedial therapists that could work with child and help them him to understand things and help him to do activities, um, and also like a teacher co-occurring like treating co-occurring condition. It is very important over here to understand that sometimes child could have other problem too, like I was talking about insomnia, like sleep problem. It could have GI tract issue, gastrointestinal issue. It could be other issues too. It could be food allergies. So we need to treat those things also, and these things need to be addressed too. And also about sensory needs, the child could have sensory needs. For example, if you talk about sensory needs is very important because uh, medication, if it is required, sometimes a child would get very aggressive. So medication is something that I don't discuss because that is not my criteria, or that is not my jurisdiction. But the thing is that it is a tricky part. Sometimes children need that if they are getting aggressive, if they're getting um, uh, if they're getting some other problems over there too. But you need to understand that it should be appropriate for the child, and try not to self-medicate your child. And if you're facing some, if the child is facing some kind of problem, just consult your psychiatrist and apply behavioral analysis, I said, because in other in some areas it is considered that it is a skill over, it is a form of therapy, but that is not the only form of therapy. You need to understand that there are other things that we can teach the children. Now let's talk about behavior, because we need to understand over here too that it's not the child problem. It's the child, when child get elder with that thing, like above 18, these things exist over there too. So what could we do if we talk in general terms? And those are programs that we need to involve siblings, caregiver, parents in in those things too. Like we need to go for social support kind of a thing, and we can have those things around us. But first is what we need to work is social communication and language skill. Other thing that reduce behavior that interfere with daily functioning. But it could be you need to reduce the distraction from the child life. You need to um, when there are some certain places when where we go, our child is not welcome over there. The child who have certain kind of needs, and when parent asked me, I said that it's up to you, that would you let people welcome you without your child? If your child is not welcome, it means you're welcome over there. You need to understand that who is important over there for you. Your child is important, or you're important. You need to decide that where you need to take your child. But the point is that take your child everywhere, to schools, to hospital, to market. Maybe if you're taking him for 5 or 10 minutes, just take your child over there and come back and sit with the child in the car. But try to take your child out. Do not, because why I'm saying that, I have uh, I know so many people. For example, I just saw uh, mm, a tweet over on the Twitter, and it was like a child was bullied in the school, and I don't know parent was listening to him or not, but the child tried to take his life. Can you imagine that, a 7 or 8 year of a child, and who is doing that? He was not. Why he will do that? Because all the problem that I discuss over here, the child is not able to communicate that he is in pain. The child is not able to communicate somebody is happening with him, because we are saying that the child is not obedient. The child show defiance. The child is misbehaving. We are all the time giving him punishment, and we are asking him to go outside the room. We are asking him not to sit with other children because he misbehave in the classroom. If certain things, those things are happening in the classroom, where we are going to lead that child. These are hidden disabilities, and we need to talk about that. We need to understand that what is the end of those things if we are not intervening on right time. So we need to understand what are behaviors, we need to interfere with that, and also increase, build upon the strength, work on the skill. We have to work on skill building. A skill is something that you can teach the child, and also learn life skill and living independently. And uh, those can those things can be also inculcated in those children. And we need to understand that what is the child, where the child is lacking, and the other thing is that two children cannot be same. So we need to understand it. Okay. So who could maybe work on diagnosis? It could be likely medical and neurological examinations required. we need to understand that what are the child cognitive abilities, child language abilities, child behavior, and in-depth conversation with child caregivers about the whole family life he has. And why it is important, we are going to understand that what will be the child treatment plan. If you go to the education side, then it is individualized education plan. But overall, what is the child treatment plan? So it will not be a one one word thing that it is autism or ASD, or before that people used to call it aphasia. Not sorry, aphasia. It was Asperger. Aphasia is something else. So you need to understand that when we will do every kind of examination of the child, like at the end, it is also written that assessment of age appropriate skill need to complete daily activities. So like I was talking about the you know the developmental milestone. I was talking about that. It is also available when there are some milestone that is available. You can have those, the information is on the internet. If you talk about, if a child is of 4 years of age, what is he supposed to do in the school? 5 years of age, what is supposed to do in the school? uh, just use that for having that understanding. Do not start looking toward your child that that constrictive eye that the child should do those things, but just take help from that. And after having our kind of examination, which we talk over here, after that we can understand that what we need to learn from to help the child. What are the needs? The child is okay, not able to go to washroom. Okay, let's start working on that. The child is not able to communicate. Let's start working on language. The child is not able to sit on the chair. We call it attention sitting span actually. The child don't have a sitting span. Let's start working on sitting span. The child is not able to pay attention. Let's start working on that. And if you will know that what are the things, you will get a lot of information on internet about that, how to develop those skills. So first, insight is important, and then we need to understand what we're going to do about it. What are the needs of the child? What are the goals of the child? Now, if we talk about adults, how they will come to, because if you are working in psychiatry department, you will get this idea that it could be overlap symptom with mental health disorder. For example, it could be ADHD, it could be anxiety disorder, social interaction and communication challenges. I'm talking about adults. It could have sensory issues, sensory struggle, or it means that, like I was talking about, smell, sound, those are some sensory things. Then repetitive behavior would be there, restrictive interest, limited friends, limited communication, no socialization, past challenges in school, challenges in relationships, challenges in family members, challenges with the wife, challenges with the children, and also difficulty in having not understanding that what is their um, personal strength. So if we are working with start working with those adults, we need to understand that what was their past challenges, what are their personal strength, and what kind of help they need. So it depends on that. Now, for parents, what they can do, they need to learn about autism as much as is it possible. Like, for example, if it's not parent, if you're a doctor, you need to understand that how to learn more about autism, and also provide consistent structure and routine for those children. It's like you need to understand, you need to make a routine for the child, and if it will be a routine, the child will know that it is my routine. Like I'm just giving you a you could say that is a journal thing. If later on we'll talk about more thing about that, how we can go toward treatment side or therapeutic side of that. But the point is that for the time being, or for a general perspective, parent need to know that what are my child routine, and the child will know that answer, and it will help the child to decrease the anxiety level. And also professional help is important over here. And also that you need to understand that you need to take as a parent, you need to have a time for yourself also. Like all the time you are doing that, but and you need to, as a caregiver of the children who have special need, sometime you can uh, have a time for your own self too. So I know a lot of parents who have their own personal struggle going around, and they are so much into their family, into their child, that they forget themselves. So if you're not in the right side set of the mind, you cannot help your child. First work on yourself and then work on your child. That is very important. It's like you cannot pour from the empty cup. And also, like, if there are so many strengths, I just give you few over here, like they have strong visual and auditory learner, they have strong memory, they're good in maths, music, art, they can remember the detail, and there's so many other things also. I just said it over here too. Just try to understand that um, like the point is that beside autism they have personality. Autism doesn't mean that they cannot learn anything. You need to understand that perspective over there too. So if we are trying to work with somebody who have autism, who are autistic, we need to understand that how to work with that person. And okay, so that's all for today. That is 1 hour presentation. So I try to make it simple, but I tried for talk for so long over here. So now tell me, did you understand that or not? Like, if you have any question. You have no question. You all understand what I said.
Thank you so much, Dr. Anila. And it's very interesting, and it's and I appreciate you. It's very interesting lecture, and we learn more about autism. I would like to ask you some questions, if it is possible. So, can you hear me?
Yes, I can hear you. You can ask me the question, but remember one thing you need to understand. In one sitting, you're not going to understand anything about that. In one sitting, it is difficult to understand so many things about autism we talk about. So yes, you can ask me question. No issue.
Sorry, I think sorry, I can't hear my network. I think my network is weak. So you please pardon it again.
You can ask me question. I was just saying that we need to have a what you could say. I forget the exact word for that, but we need to have more sessions like that. Then we will able to understand that, because it is a very vast thing. If we talk about because today I talk about something you would see maybe on daily basis, but it might be intellectual disability. It might not be autism. It might be ADHD, but not autism. So if you talk about developmental psychology, or we talk about child psychology, child mental health, or in general, if you talk about child, we need to understand the developmental milestone first. So it is kind of a stepwise thing. We cannot understand from one day. But even then, if you have question, I will ask you. And if I said that we need to have another discussion on that, then we will do that. But you can ask me question right
now. Thank you. I understand and I get it. And I'm thinking about in Somalia or in Somaliland, it's autism in Somaliland. Generally, autism is new to us. Or I don't know if the autism children was kept in the homes, and I think people are just understanding about modern medicine and possible help. So I understand no one is zero. No one is zero, and everybody can learn something. So to your best experience or to your best concept, as a clinical psychologist or a speech therapist, how was the improvement for autism children when you meet them? How do they improve?
Okay. So your question is very much relevant, and even over here, even if somebody's in you could say
can I add another question?
Yes, you can ask. No issue with that.
So my second question is, in Northern America or in USA or in European countries, they say, or they said, autism children are usually those who from Africans, like African Americans or Caucasian, instead of native USA or Europeans. So what are the root causes, or what are the is there any specific causes about autism?
Okay, let me tell you something. If we talk about autism, it is everywhere. Like, people think that now autism spread. It's not a kind of a viral infection that it could spread. It's not a viral infection that it could spread. The point is that it could happen to anyone. Like, I'm working with community. Like, I just have one support group in the last week, and that there was people from everywhere, like around the world. And if you look toward my podcast, that is Spectrum Talks and Tips International, you will find people from all around the world. And those of most of them might be, or a lot of them are autistic community, like they're autistic. So it's not about having African American background. It's not about certain. It's not limited to certain people. It's not limited to certain culture. It could happen to anyone. And sometimes people think that genetic perspective is in there. Like, if genetic perspective in what terms? If parent is autistic, then the child might be autistic. If parents is some form of neurodivergent, then the child might be neurodivergent too. So it is something like that. So it's not about people from African country. It is everywhere. It's not about people from third world country. It is everywhere. And it is not even about children. It is in adult too. They have this all along in their life. Let me tell you something. I just asked this question, that what was your age when you were diagnosed with, when you were diagnosed like that you have autism? The age was 78. Like, 78 years old person was diagnosed with that. Then somebody told me that his grandfather was 82 years of age, and at 82 he was diagnosed as autistic. So it is there, and it was there. Right now people start talking about it, and sometimes it become trend, it become fashion too. So it's not that it is coming from some certain culture. It's not like that. There are certain traits. For example, if we talk about African American, like specifically for, if we look toward the region of Africa, they're strong people. They excel in sports very well. Like, you cannot take Olympic medal from them. You'll have this idea too. Like, if you talk about even Australian, they are very good in sports too. It could be certain things could be like that. But if you talk about that thing, if you talk about autism, it's not like that. Certain people have this and certain people don't have this. There are so many theories around that. People have spent so much money on the causes of that, but they cannot understand it from where that is coming. Some theories are like that. There's the gene present in some people. So we all share gene. Like, we have one, one father concept. Like, we came from one couple, and then we spread. So it is something like that. That is prevalent over there. But the other thing was that the other question that you have, we have worked with people, and I have seen people from no speech to reading and writing. Like, a child was not able to speak, but they read and write. And if you want to understand that how much they excel, just try to, if you have some time, if to those people who will watch this, or those people who will watch this later on, you can see amazing people who were autistic and they excel in their life. Like, yesterday I was talking about, yesterday I talked to a woman, and she's working as a mental health, like the way that you're working, and she's also autistic. Before that, she was diagnosed with ADHD. So now she have a profession, she studied, she's working. So it means that from having this diagnosis, it doesn't mean that the life ends over here. That's what I'm trying to say again and again. We just need to understand what are the child, it's same like you have two children at your home, and one is good in maths, another is good in English. So difference is there. So one is listening to you, other is not listening to you. One is um, uh, good in sports, another child is good in maybe creative writing. So it is differences over there. And the way we deal children, it's more like a difference, and we need to have a different kind of uh, approach toward those individuals, so that those who are neurodivergent. So if you say that those children improve, yes, they improve, they excel. There are so many even footballers who are autistic. There are scientists who are autistic, maybe politician. I just did one interview, and he's from his name is Constantine. and he just become first mayor, autistic mayor. And then there's a model which I talked to. I'm trying to have a chat with her also. And, she becomes a Miss Florida. And then there's a woman who got award on her acting. Her name is, I guess, Heidi. So she's also autistic. So we have so many examples around us having autism and excelling in their life. So now you get the answer of your question.
I get it. Thank you so much. And I would like to welcome the participants of the training. If they have any questions or comments or suggestions, you welcome.
Okay, thank you, Dr. Thank you for training, especially child mental healthy. It's very necessary training to us. Do you hear me?
Yes, yes, I can hear you.
I will ask you some questions, if possible. In your experience, do you ever see or do you ever meet a child who have a combination of ADHD and autism and other mental illnesses?
Mm-hmm. Yes, I got the question. Yes, they have. Even there are adult too.
Okay.
Yes, they could have.
Okay, thank you. Okay, thank you. My question is. Okay, thank you. My question is, we have a child who have a different symptoms like hyperactivity, attention deficit, and the same time at the same time he plays the same way. He have a hand movement, repetitive movement, and also he does not he can be able to communicate. Is there any specific points that we give the parents as a counseling if the child have a different or multiple or combination of child mental disorders? Thank you.
The point is that you are asking that you need to give counseling to the parents, or you need to work with the child. This is your question, that if a child is with multiple problems or he have different needs, you are saying that how to work with that child or how to give counseling to the parent. Is it your question?
Yeah, yes.
Okay. What you can do is, this is what I used to do, and this is what I still am doing, that I start reading about those symptoms. And by reading about that, about reading about autism and ADHD, it helped me understand conditions more. And when I'm talking to parents, my information that I have, that I gathered from my study, help me to counsel those parents. So I think you can do that too. That read about it, understand that what it is. If you understand that child have autism, or if you think that the child have ADHD, or the child have combined things, just try to read about it and try to tell that to the parents. And the other thing is that in practice, this is what I learned, that you need to say things as it is. Like, you cannot sugarcoat thing in terms of, maybe you use different language, maybe you're counseling them, but what is the child state, say this exact. I know many people that who try not to do that. Sometimes they're thinking that they're treating parent for certain things, or they are not telling certain things, so that maybe sometimes there are few conditions that could work out when you're doing therapy instead of medication. But I have seen doctors who give medication to those children so that they come to them all the time. Like they have regular visits, and this is what people used to do. But the point is, with parents, learn about that thing and then tell the parent. So, getting the idea that what you can do over here.
Thank you, Dr.
Thank you. Is there any question?
Hi, Dr. Anila,
Hi.
and I would like to ask you something. It's totally different question of doctors.
No, you can ask me. No issue with that.
And if you, my question is, as Dr. told you, yes, people in a lot of parents, a lot of people always talk about food. Is ADHD or autism, is it related to the food? Let's say some parents say, oh, maybe that's the food the parent were eating while this maybe this kid was, you know, not born yet, or maybe is the food actually the eating was that's how people, you know, autism and ADHD in my country. Is it food related?
You know, let me tell you something. There are few toxin and poison that could aid into intellectual disabilities. Like, for example, lead. And there are other toxin too that is going to determine that if they're not eating, clean food, it could get trouble. Like, for example, if somebody is using drugs, there are chances that the child could have some problems when they are born. If they are, like if there's domestic violence, let me give you an example. I was working with a woman, and she came to me that when she was pregnant, her husband used to beat her all the time. Like, that was a domestic violence case. And one day, it went very bad that she, she got some emergency condition, and she went to the hospital. And when she went to the hospital, the baby birth was premature, like before time that baby was born, and the child have problems. Like, we know that if child is premature, the birth is in under certain condition, because it was kind of a medical emergency, so they have to operate that child in some emergency. So it was one of the cause. There are some causes that could lead to maybe not autism or ADHD, but other intellectual disability and other problems too. Like, when I was talking in the start, uh, in different areas still people don't go to hospital for baby birth, so the child is born in house. And if it is a house, we know that sometimes the child needs oxygen. If the child may not get oxygen, it could result in a kind of condition that is called cerebral palsy or hyperlexic child. There could be other problems with their children too. And as far as the food is concerned, um, if there are some pesticide, you would say that, like I talked to you about lead. And just because of lead, or just because of other toxin in the water, in the environment, it could lead, because there are so many studies on that too, that just because of that the child is having that kind of trouble. But uh, that kind of maybe intellectual disability, other problems over there. But if you talk about ADHD and autism, it is not, I would say that, um, they're not a specific study about that. Like, yes, it is because of that. Like, a autistic child is born because of that, or ADHD child is born because of that. So even sometime in my country, people would say that a child is using a lot of mobile phone, and the child get, because they're having screen time a lot. Because the condition that we discuss, if the child don't know how to talk to people, how to play with people, the child go toward the technology, the child go toward video game, the child go toward mobile all the time. Or maybe adult are doing the same thing too. But over here, we need to understand that this is not the cause of autism. Autism was supposed to be in any form, with screen or without screen. So if you talk about even food too, yes, there is one thing you need to understand that too. Sometimes children have food sensitivity, like the food that they eat. You need to check that thing also, that why the child is having certain behavior, like the behavior that we were discussing. It could be sometime the reason of some food sensitivity too. We need to rule that out also. And the other thing also, that sometimes children have sensitivity. It could be wheat, it could be gluten, it could be other things too. So we need to identify everything. But poison could lead to other conditions, like intellectual disability, which is also called mental retardation in the older terms. Now we call it intellectual disabilities. So, and there are certain studies which indicate that artificial flavor, artificial food, that is uh, aiding into different, you could say that learning problems. That just because of that, child could bond with certain things, but not specific those things. So I think you get the idea what I'm trying to say over here. It is responsible for not responsible other things, but not responsible specific for autism or ADHD. But poisoning have effect on the. There's a lot of study over there too, like those areas who was bombarded. Like we have example of Hiroshima and Nagasaki. Still, children are born with disabilities over there, so we can understand that it has effect on people in around surroundings. So now you get your answer or not?
Yes, yes. And I was writing down. Thank you, Dr. Anila. And I hope we're gonna have a more, Zoom, because it's really I learned a lot tonight. Thank you very much. Thank you. And I hope that we will learn and we'll go everyone in our country and will help more people, because it's something that's is not really like the doctor said, is unknown. People just taking lightly. But today, when you were talking about of movement, the head, not talking, not singing, I was like, oh, I know few kids. I know few kids that me parent would say is a curse or something, but actually I know actually what. But I cannot, like Dr. Ahmed say, I cannot give them today diagnosis. But it's really good, and we are ready. I'm ready, and thank you very much.
And the thing is that the point is these conditions are workable actually. It's not that you cannot do something about that. Like I told you that I work with children who with no speech from reading and writing. And like I was working with a child, and I'm also taking online sessions too. I was working with child, and in when we are doing something online, like if we're doing online session, then you need to involve a parent or caregiver in that too. And the mother was not sure when we used to start, and I was saying that you will see that the child will, and she was said, oh okay, I will see about that. But even then she was putting effort into that child, so we were doing a lot of things. We have different activities. We were doing different things on in the sessions. And uh, she because that was a COVID time period, but the child was responding to me, and I have even those videos too where the child is responding to me. If somebody want to see them, you can see them on my YouTube maybe, or maybe Facebook over there too. And now the child is going to school, and maybe it's a special school, like specially designed for that. The child is responding, and she is so happy, so happy. And she's sending me those videos, and I just tell her one sentence, like after like saying alhamdulillah, after that I said that I told you that the child is going to talk. And she said that yes, you were right. So hope is always there. These are workable conditions. As a human being, we have maybe limited abilities because we are human beings. We are not God, and we don't act like a God, and we don't say people that which things are not possible. So we do things that is like we are doing things on persistent level. We are giving sessions on regular basis. We are working with child on regular basis. And over here, regularity is important. Persistence is important in the work that we do. After that, children start getting, even if you're saying about that culture aspect over here people would call him, some person who could, they will start making shrine over that person, and this person, start doing other practices. And over here things are not that very good, I would say that. Still we struggle with so many things, and I think same thing is happening in the other part of the world too. Even I am talking to people who have best of the best doctors, maybe best of the best institution, best of the best school maybe, but they are still struggling over there. There's still problem everywhere. And what we do as a human being, we can deal with that. So somebody else have any question?
I think if there's no any questions or comments, we will conclude. this session.
Yes.
So before the end, I would like to ask you, Dr. Anila, thank you for your contribution. Thank you for your interesting lecture. And I think, and I hope all the participants learn a lot about autism in terms of clinical features or signs and symptoms, level of autism, and also the way of approaching, and also so on. So can we share with you if we met some children, those who have autism, can we share with you?
So let me just, I'm just cutting you over here so that I'm just going to stop this recording and then we will discuss after that on. So thank you so much, everyone. And I think that's end of our discussion. And we will have, like, I would like to have those on regular basis. Like I'm saying that
Okay.
I just recorded that so that other people, or maybe you all come back over there too. And there is a very big term. And we are touching maybe small things that over here, but we will do this on continuous basis. So thank you so much, everyone. And in the next discussion. Allah Hafiz. Bye-bye.